let us discuss about a topic regarding retinoblastoma. Retinoblastoma is the retinal tumor, most commonly primarily occurring malignancy, primary ocular malignancy in the childhood. Most common primary ocular malignancy in childhood. It is caused by the mutation in the long arm of chromosome 13q14, which codes for RB1 gene. So it affects the precursor cell that form inner and outer retinal cell, leading to their malignant transformation. So this RB1 gene is important for the formation of inner and outer retinal cell. Whenever this RB1 gene is affected, their precursor cells are affected. That leads to inner and outer retinal cell malformation, and that causes malignant transformation. Genetics is most commonly the mode of inheritance is heritable and inheritable forms. Heritable is germ layer and non-heritable is your somatic line. The germ line and somatic line both contributes to the disease. The second hit, whenever first hit of mutation won't cause this disease, whereas the second hit that affects the second allele will lead to the malignant transformation. Basically, both gene coding for this retinoblastoma transformation will cause the malignant transformation. So these patients predisposed to non-ocular tumors such as pinealioma, osteosarcoma, and malignancies of brain and lung are more common association. So most commonly retinoblastoma patients will have these tumors also, like that they are saying. In Corona reference, it is giving that pinealioma, osteosarcoma, and malignancies of brain and lung are associated. Most commonly presentation within 1 year, it is bilateral presentation. In unilateral means it is 2 years, and leukocoria is present. Very important. Cat eye reflex, amerotic eye reflex, and white pupillary reflex. Leukocoria, one of the most important DD. What is that? Is loss of transparency behind the pupil is present. Loss of transparency behind the pupil, that is your white eye reflex or white pupillary reflex or cat's eye reflex or amerotic eye reflex. So this is if it is present unilaterally, then it is the most common DD is retinoblastoma. If it is present bilaterally, means that is mature cataract. And strabismus is present, secondary glaucoma is present, and proptosis is present. And there will be inflammation secondary to the tumor. On examination, you will see scleral indentation, and you will have white mass calcification, maybe intraretinal endophytic tumor projecting and seeding in the vitreous, and it has an exophytic growth with subretinal mass overlaying the retinal detachment. Histopathological examination will show Flexner and Wintersteiner rossetti. Flexner and Wintersteiner rossetti. Flexner and Wintersteiner rossetti. Homer Wright rossetti are present. Flexner, Wintersteiner rossetti. Flexner, Wintersteiner rossetti, and Homer Wright rossetti are present. Investigations include USG CT to assess the tumor site and the size and calcification. MRI show optic nerve extraocular extension and pinealoblastoma is present or not. Treatment include your primary enucleation is present. Unilateral cases with advanced disease and large tumor, long-standing retinal detachment, and in neovascular glaucoma, suspicion that optical nerve and invasion of extracellular mass is present means you should do primary enucleation. That is very important. If you have one unilateral eye with retinoblastoma, or large tumor or long-standing retinal detachment is present, you need to go with primary enucleation, and you can do photocoagulation and chemotherapy here in some other cases. So this is about your retinal detachment. A brief summary means that is the most common primary ocular tumor in the childhood, where it affects the RB1 gene. Here second hit of the gene mutation will cause malignant transformation, and it is most commonly associated with pinealioma, osteosarcoma, and the malignancies of brain and lung. And it is presentation unilaterally means it is less than 1 year, and unilaterally means it is 2 years. Bilaterally means it is 1 year, and it is often associated with leukocoria. Leukocoria is amerotic cat's eye reflex or white eye reflex or cat eye reflex. This is loss of transparency behind the pupil. That is your whitish color deposit, whitish color pupil is present, and it is bilaterally means it is mature cataract. Unilaterally means its most common DD is retinoblastoma. When your strabismus, secondary glaucoma or associated, often associated, and your proptosis is present, and inflammation due to the tumor is present. Your signs include your scleral induration, and it shows a white mass with calcification, maybe intraretinal endophytic tumor or exophytic growth is present. On histopathological examination, show Homer right rosette and Flexner Wintersteiner rosette. And your investigation is USG CT to assess the size and site of the tumor, and MRI shows the extension of the tumor. There is optic nerve extension or extra extension is present or not. Your treatment is include your primary enucleation if it is unilateral and it is going to long-standing retinal detachment. Your photocoagulation can be done and chemotherapy can be done.